So please go to a psychiatrist who understands addiction, understands the danger in prescribing habit forming medication. Another thing that I've seen working in treatment a lot is people that are prescribed stimulants for ADHD while they are trying to be in recovery from addiction. And I have ADHD. I take medicine, but it's a non stimulant. Look, I'm not a doctor, guys, but to me, if you can do anything to avoid taking a habit forming substance when you're in recovery, it's the smart thing to do because anything that can produce that kind of euphoria, anything that can be abused, basically, you're running the risk of either getting addicted to that or it causing a relapse from your original drug choice. So again, please, if you have the means, go to a psychiatrist who specializes in addiction. The other thing I would say is don't try and manage your own medication. So, what I've seen working in treatment, I've talked to thousands of patients that are trying to recover from addiction, that are trying to stay clean and sober. And I've heard this so many times. They'll get on a medication. It's real common with antidepressants, and they stop taking the medication because they feel better. And I've said this in an earlier video, but it's like, it's so funny. I'm trying to think of something compare it to, but it's like you're basically abandoning the thing that made you feel better because you feel better. So it doesn't make any sense. But I see this all the time. People think that their depression is, magically cured, or so they stop taking the medication. And not to mention that some of these medications, like antidepressants, if you stop taking them abruptly, it will make you feel squirrely. This happened to me one time. I was on Celexa, I think it was, and I ran out, and it was like a 3 day weekend. Right. So I wasn't able to see my doctor until a Tuesday, and I ran out on a Friday. I started going fucking crazy. I didn't understand what was going on. And again, this was unfortunately, I was only seeing my family doctor at this point. And again, I feel like doctors a lot of times they don't do their due diligence as far as warning people about the side effects. At least that was the case for me. Um, so again, I was crawling out of my skin, guys, and it was a miracle that I didn't relapse because I just needed something to fix the way that I was feeling. Luckily, I called their emergency line and was able to get a refill for my prescription. But that was a lesson learned for me, and a lot of people, I've heard a lot of the same stories. Some of these medication that is prescribed for mental health, you can't just stop taking. You have to be weaned off of it because your system goes crazy when it just stops having it all of a sudden. So again, don't just stop taking your medication because you feel better. Another thing is don't stop taking your medication because you don't like the way that it feels. Again, because of the nature of a lot of these medications, it has to be something that is controlled by a mental health professional, hopefully by a psychiatrist who really understands addiction, because the need to be weaned off of this stuff for the medication to be changed. So don't play around with the medication. If you're prescribed it by a competent doctor, and even if you don't like the way that it's making you feel, call your doctor and ask them what to do. Don't just take yourself off of it. And some of this medication too, guys, you just got to be really careful, and you need to be taking it under the supervision of a competent medical professional because of the risks, because of just different things. It just needs to be managed by a competent medical professional. And don't get me wrong, guys, I swear by. I've been taking antidepressants for many, many years now, and I've had to switch a couple times, but it definitely helps me. And I take a non-stimulant for ADHD too, and I feel like that really helps me too. So it's not that I'm not a believer in medication, but it's the thing with mental health a lot of times is unfortunately it's different than where they can just organs that they can just take blood tests, for example, and see how the body is responding to it because it's the brain. Unfortunately, and what happens a lot of times is you're trying different medications to see how they work, and they need to be given a chance to work, and sometimes they don't work. Sometimes they make things work, so you got to switch, but it has to be under careful supervision of preferably a psychiatrist who specializes in addiction or is very competent in addiction. So just please do this under the supervision of a mental health professional. Unfortunately, a lot of times when trying to find things that work for depression, anxiety, stuff like that, they may have to try multiple medications to see what. Sometimes it's almost like throwing a dart and see what sticks. But again, I'm a believer in it. It's helped me for sure. So, don't, I would say give it a shot if you feel like you may need it. There's also something now recently they've come out in the past few years. I believe they've come out with a DNA test, which is supposed to give the mental health professionals a better idea of what works for you, what kind of aligns with your DNA, so to speak. So if you have the means, again, I would highly recommend asking about that. So be diligent about taking your medication as prescribed. If it's not working, some of these things can have serious adverse effects. So just make sure that you are working closely with your mental health provider in these circumstances. The other thing I would say, guys, the last thing is that addiction and other mental health disorders overlap, but often they need to be treated separately. So what I mean by that is what I was going back to what I was talking about at the beginning, how people, they'll treat either their depression, their anxiety, whatever, but they're not treating the substance abuse, or they're treating the substance abuse and they're not treating the depression, anxiety, bipolar, borderline personality disorder, PTSD, whatever. So really the best way to go about this, again, through a mental health professional, preferably a psychiatrist who is well versed in addiction, making sure that you are treating both. So what I've seen a lot of times is people will get into recovery from substance abuse, and I've seen this a lot with 12-step programs, and sometimes even people who don't know what the fuck they're talking about will recommend people get off of medication or don't take medication within 12-step programs, and they don't know what the fuck they're talking about. They're not doctors or whatever. So again, this needs to be handled by a mental health professional. So a lot of times what people do is they get into the 12-step program of recovery, and it's helping them stay sober, but they use it as this cure-all for everything. They think it's going to cure everything. So for example, if I get into a 12-step program, let's say I'm addicted to alcohol, whatever, and I get in a 12-step recovery program, I start working the steps, and it's helping with the substance use disorder, but I'm failing to recognize that I have this other thing going on that needs to be treated as well, then this thing is probably going to take me back into the addiction. And I've seen it a billion times, guys. So a lot of times people get such a sense of relief when they get into some kind of a recovery program and they start feeling better, and they get this idea that it's going to fix everything. I've been like this. I've seen it with other people where it's all, they call it like a pink cloud effect, where there's this, because they're feeling better for the first time in a long time, that they think that everything is going to be better now, and sometimes there's a lot of naivete to it where people think that they're going to be magically healed, they're never going to struggle again, life's going to be perfect, that and the other. And what happens a lot of times with that is they think that it's going to cure their other mental health problem or other things that are going on. Don't get me wrong, recovery, abstinence from substances, getting clean and sober will help your mental health 100%. But if I have something else going on inside my brain, just being clean and sober, although it's going to help the problem, it's not going to cure it, right? So I need to be tackling both things. Guys, I hope this was helpful. Please, if you're in recovery, if you're trying to recover, please get the help that's available out there. Please tackle both sides of this, the substance abuse issue and co-occurring disorders. that is going to give you the best chance of staying in long-term recovery and not relapsing. So guys, again, I hope this video helped. If you feel like it did, please give it a like. Please subscribe if you haven't. I really appreciate it, and I'll see you guys in the next video. Thanks.